Thank you very much. It's a real honor and pleasure to be here today and to follow Dr. Barnes. And I just want to say, Lisa and I never talked about this. This is just how we came together, and her background is talk this morning was fantastic. So I think we owe her another round of applause. Amazing, amazing. So I'm going to pick up on what Dr. Barnes was talking about. And her last slide was exceptionally prescient, or gave us a good way to think about brain health, and that is putting things together. And so I'm just going to give you a little background and to talk about one of my heroes, Donald Lloyd Jones, and you'll see a little bit because he came up with Life's Simple Seven, and now it's Life's Essential Eight. So what do we know? And I think Dr. Barnes was talking about this. There are all kinds of factors that affect our brain health that begin in early life and continue throughout our life. And as Dr. Barnes pointed out, some of these are early life experiences, but others can affect us in middle life and later. And so the key here is, what can you do today to help your brain? And one thing that Dr. Barnes talked about is the term Alzheimer's disease in that umbrella, and I'm going to steal that slide. That's just a fantastic slide. And the point here is that when we think about Alzheimer's disease and the risk factors, and this is from a study done a few years ago, my colleague, who's the co-director, Dr. Rachel Whitmer, came up with or confirmed a risk profile, and showing that that you could predict your risk for Alzheimer's disease. And what's on there are things that are related to things you can modify: weight, cholesterol, blood pressure. And so that's the key things I'm going to talk about this morning. Why am I going to talk about that? Because when we think about Alzheimer's disease as an age-related, and this is from the Framingham Heart Study, one of the things that we often don't talk about are the other things that affect our lives. So besides Alzheimer's disease being age-related, the other thing is stroke. And strokes are very common, but also hypertension, okay? And these are common, and in fact, many of us, I'm one of them, have hypertension, and it's very treatable. And what we see is that in these age-related increases of these illnesses, whoops, oh, it didn't work. Oh, well, we see changes in the brain too. And the vascular disease and the risk for Alzheimer's disease, as you can see on this slide. So these are men and women, and this is just looking at the relative risk for stroke and Alzheimer's dementia. And you can see, particularly for women, they're almost identical, and men, they're more likely to have stroke than Alzheimer's disease. And the point here is that the two hang out together. And it's very common, as Dr. Barnes pointed out in her slides, to have both of them in your brain. Now, we may not have the ability to modify Alzheimer's. We're getting there. But what we do know is vascular risk factors, common vascular risk factors such as hypertension, diabetes, lack of exercise, are associated with an increased risk of getting demented by the number of vascular risk factors you have. And that this seems to be a more in this study was by Dr. Whitmer, which was the one that she made the scale from. They were 75% of them were white Americans, whereas in Jose Lexington's study, only about a quarter were white Americans, and the other 2/3 or 3/4 were African and Latino Hispanic Americans. And you can see that the likelihood of getting dementia based on these risk factors, because they were more prevalent, is actually higher. So it's more preventable if you, your risk is greater if you have more of these factors in your life. Why is that the case? When we think about people who go through life and develop what looks like Alzheimer's disease, this pie chart shows what they have in their brains when they pass, okay? And Alzheimer's disease is in these various colors. So the red is 51% Alzheimer's disease, but there's Alzheimer's disease in all these areas. See, these 4 areas have Alzheimer's disease. What's important to note is, though, that Alzheimer's disease has friends and followers, and that when you look at vascular components, that additional increases the amount that's occurring in people with dementia substantially. Okay, so that, like Alzheimer's disease, vascular injury to the brain is very common. So just going to do these summary slides just to make sure I communicate effectively. To just say that vascular risk factors are common, they have an impact on our brains, and they put us at greater risk, even if we have Alzheimer's disease, okay? So I know you saw this slide, and this is just another way of showing the same thing that Dr. Barnes showed, that what we have is a picture of our aging brain health, and we think that at least part of this is related to underlying brain injury from many different things, okay? Alzheimer's disease, vascular disease, Lewy bodies, et cetera. What we want to do is we want to change that. We want to reduce the injury so that that will keep our brains healthy. How can we do that? At the public health level, it is fascinating to see. And I'm a Framingham investigator. So Framingham was the first to identify the role of hypertension in health. And that was back in the late 50s, early 60s. And since then, we focused on hypertension. And what's happened in our population is that individuals' average blood pressure has moved down. So here we are back in 60 and 62, this gray hill there. And this is what the mean, this was the average systolic blood pressure. So it was 140, and people were considered normal back then. But now we know that that's not normal, and we're pushing that down. Why is this important? Because consequently, the number of people who are dying of stroke and heart attacks have gone down by about 25%. So it's made a huge difference. And the point of this slide is that that can be you if you have any of these risk factors. And this is another way of plotting it to look at various diseases: heart disease, stroke, high blood pressure, and high cholesterol. And you can see they're all going down. And then, so we can affect these things. And this is looking at just individuals who have it by their heritage, by different heritages. And you can see that there is disparities in healthcare in America. I'm not gonna lie to you all. There's disparities in healthcare in America, and we need to rectify that because it is causing disparities in illness. Now, how much do you think you could benefit yourself? Well, it turns out, and this is something done by Deborah Barnes and Christine Yaffe at UCSF, they calculated if they modify these various things, some of which are health related, and that's what I'm focusing on, but other things are social determinants, such as depression, smoking, social engagement, as Dr. Barnes talked about. All these things, if you add them up and you could modify them all, you could reduce your risk by a quarter. That's a huge effect. And that can start today. It's not something that you have to wait around for. Okay, so there's a busy slide. I'm not going to ask you to try to read all the things that are on this busy slide, but just to point out my hero, Donald Lloyd Jones. And back in, I don't know, 1990, 2000, he was one of the members of the American Heart Association. And who came up with goals to help reduce heart disease. Okay. And so he came up with Life's Simple Seven. And that has to do with 7 factors that we have control over: smoking, eating a healthy diet, physical activity, weight, blood pressure, total cholesterol, and your sugar. Okay. And he adds those up, and you can get from 0 points to 2 points. And 2 points means that you were never a smoker, or you were greater than a year past, etc. Okay. So high scores are good, low scores are bad. Okay. And he came up with this in 2010. And now he has added one other thing, and that is, how well do you sleep? Okay. And I'll show you in a minute that you all can actually find out how you're doing. You can go onto the website and find out how you're doing. And one of the things that's important about this is that these things also sit in the same context of what Dr. Barnes was talking about. All right. It's a part of your social well-being and your physical well-being. I'm talking more about your cardiovascular health because I'm kind of like a cardiovascular neurologist. But it's also important to know that we sit in a society, and that we need to be engaged in our society and receive the help that our society can provide. Okay. Dr. Barnes talked about diet. I'm just going to take a little tiny moment to talk about some of the things that are important about diet. And it's some of the stuff that I learned as I was reading on this issue. And that is that we don't want to eat based on nutrients. In other words, you're going to go, you see all this thing, and I was just shown one in a supplement. Oh, 2% this, 5% that, blah, blah, blah. No, focus on what you're eating. Eat the right foods, okay? And you don't want to have fancy diets. Keep it simple. And my mother-in-law said something to me, and I think this is absolutely right. The more color, if you look down at your plate, and the more colorful your plate is, the healthier your diet. I won't go over this because Dr. Barnes talked about it's the DASH diet, but I will show you that there is also other diets. And as Dr. Barnes pointed out very clearly, it's not a particular diet. You can do the DASH diet, particularly if you have hypertension or you have kidney disease. The DASH diet might be more helpful to you. But any diet that gives you more green leafy vegetables, less red meat, staying away from the butter and everything, and fried food, that's the killer I think we get into. That will be better for your brain. And I have adopted, I have oatmeal for breakfast usually when I'm not traveling. And all I did is drop some blueberries in there, and look at me, I'm a healthy dieter. Okay. The second thing, though, I want to talk about is sleep. Okay. And another few words about sleep. Okay. And that is too short is too bad. Okay. So people are constantly on the run and on the go. And I think all of us go through life with changes in our sleep patterns. Okay. So too short's bad, too long is bad. But it's not about the duration per se. It's about what you're doing during that time. So people with chronic pain are often getting up. Some of us who are a little older as men are also getting up, maybe more than once or twice. And so the best sleep is the best quality of sleep, not necessarily the duration of sleep. The second thing, and actually, this is really important. And again, I learned this when I was preparing for these talks. The best way you know if you're sleeping the right length of time is if you wake up on your own. Okay. So for me, it's about 7:30 in the morning, even on the weekends. I'm up. Okay. That must be it. I'm done. And that's a good thing. Okay. That means I got enough sleep. The other is about oxygen. Okay. It is very, very common in my clinic to have people coming in with memory complaints who tell me about their poor sleep habits. And then I realize that maybe there's something going on during their sleep and they have sleep apnea. And sleep apnea is undiagnosed commonly. And so if you feel like you're not getting enough rest, particularly if you're very sleepy during the day while doing routine things like driving, that's a time to see somebody about getting checked up. And I won't get into this, but there are different types of sleep apnea. All I want to say is that the obstructive form is usually the most common. And as we get older, the back of our throats get not weaker, but relax, and that the tongue slips back. And that's what leads to the apnea. You do not have to snore to have sleep apnea, by the way. There are people who don't snore at all who have sleep apnea. There's some people that snore like crazy and they don't have sleep apnea. But if you have a partner and they're saying you're snoring and you're feeling tired, get it checked up. And these are the risk factors. So they're very common: overweight, neck circumference. That's something that I didn't know anything about until I started working in this area. It turns out that that's very important, and it does not necessarily relate to your overall weight. Okay. So if you see a lineman in the NFL, their necks are about this wide, yeah, they're at risk. Tonsils, adenoids, being a male, being older, and having a positive family history. Other things that are important, and I think this is one of the things that troubles me, is that people start having issues with their sleep. And so they go to their primary care doctor and they said, oh, I can give you something. Here, you take this medication and that'll help you sleep. So they're taking tranquilizers to help them sleep, or they're drinking every night and going to sleep with alcohol. All of those worsen because they relax the back of the throat. Smoking and other medical condition. Interestingly enough, congestive heart failure, which is common as we get older, is another risk factor for sleep apnea. Don't know why, but it is. All right, here's how you can check your cardiovascular health. Life's Essential 8, and again, the higher the number, the better it is. And I will have, oh no, rats. All right, well, go to the website, go to your Google and look up Life's Essential 8. I used to have a little thing that would pop up and tell you how to get there, but you can do that. And it gives you actually can see this for yourself. What does this mean for your brain health? This is a study called REGARDS, and it looks at the reasons for geographic and racial disparities in stroke. And I don't know if you all have heard this term before, but you all live in the stroke belt. Kentucky is in the stroke belt. And so this study was to ask the simple question: how well does your managing your health impact your thinking for people who live in the stroke belt, and mostly focused on white or African Americans. There were not very many Latinos in this study. And here's what it looks like when you get your when you do your own ratings, and you see that some people are way down here, but they're very, very few. Some people have ideal health management. They're very, very few. Most of us are right there in the middle, okay? But what we do see is that there's a little bit of a disparity in African Americans versus white Americans. And again, this reflects that there tends to be more hypertension, primarily more hypertension in African Americans. This was 17,000 people. I just want to say, this is a lot of folks, which includes most of us sitting in this room. They represent people that are here in Kentucky. And so they were assessed regularly. That was over almost 10 years. And this is what they found out. And this is really impressive. Okay, so those people who are doing poorly, they're low points on the score, okay? Their likelihood of developing, now this is incident, these people were all fine when they came into the study. About 4% of them developed over the 10 years, developed some level of cognitive impairment. And this is true for, and it was greatest for whites versus Black African Americans. But what was also important was that those people who were middling or excellent health did much better by almost a half. Okay. And so this is a very real, legitimate, they were about 60 some odd years old when this started. So many of you in this room would have been excellent candidates for this, and to show you that you can modify your health right now. This is just to say that this worked if you looked at it as a whole, and some of the components were a little bit better. Cholesterol did not seem to make as much of an impact, whereas hypertension was a big, strong factor. And then we've looked at this in the Framingham Heart Study to look at what happens when to your actual brain. Do you have strokes? Do you get dementia? And again, in the Framingham Heart Study, it's been going on for a long time. We have all of this information, and we can see that it reduces the risk of both stroke and all-cause dementia substantially, particularly people diagnosed with Alzheimer's disease. And we did it slightly different, but it's the same kind of thing where we just divided it into half. You just take the 14 points and divide them in half. And that also, and this is just, instead of saying, do you have dementia or not dementia, we actually looked at their cognition on certain tests that, like Dr. Barnes had done and showed you. And you see the same kind of results where there's improvement in the thinking ability and also less atrophy of the brain. So even the brain structure was preserved. And you can see that here. And so then others have confirmed this in other groups. This is the CHAP, which is the Chicago Healthy Aging Project, which is 50% white and 50% African American of equal socioeconomic and education. So they're a little bit more balanced. And then this is a representative group of Hispanic Latino Americans, and showing that these things have the same effect. So it doesn't matter what your background is, you will improve. And same thing, another way of looking at it is to pick one of these things, and one of them was physical activity. I'm a big physical activity guy. By that I mean not that I do it, but that I promote it. So I'm big on hypertension and physical activity are my two, number one and number two, and reliably they show that this is improvement, considerably improvement. So I'm going to finish off with what the American Heart Association, it's kind of funny that the American Heart Association is talking about brain health, but they're very big into it through the stroke side of things, okay? And Dr. Barnes was focused on the Alzheimer's side, and I'm sort of talking about the stroke side of things, but they happen together, so they're mutually meaningful, okay? And that this, they came up with this defining optimal brain health. And this is a busy slide, but what I want to say is there are some factors we can move. There are other factors we can't move. You can't change, you know, your sex at birth is what you're given, okay? Your current age, you can't change those kind of things. But there are things you can modify, as we have been talking about with Life's Essential 8. And then, and this is, I'm sorry, I'm going to get on my soapbox. Well, maybe not, but I'm going to preach a little bit here, and that is things you can also do is impact through your vote on how our health system improves health for everyone. And that's a big thing that we're into at UC Davis. Thank you. And it starts obviously with you, and then in teaching your healthcare practitioners, ask your healthcare provider about Life's Essential 8 and what that means to you. I have to say, when I was developing hypertension, my primary care provider said, "Hey, it's not that bad." Yeah, and then I got into trouble, and she's like, "Oh, I think you need some." So educate your healthcare provider, but also work on your health system. Okay, and you can do that by voting. All right, and then this is the last little bit about critical windows in improving it. I would say that for this group, you start now, but if I'm talking to other groups, young people, I say, get your blood pressure, take your blood pressure. These are things you can modify, okay? So you can take control and you can change your life. So the idea here is back to this picture here, brain injuries, you get older, not so good for your cognitive ability. We reduce that, and I'm done. And I want to just say that current efforts to improve vascular health through life's essential 8 offer us, as an individual and a public health opportunity, to remove one of the biggest causes, risk factors for dementia. It will not take dementia risk away, but it will reduce dementia away, but it will reduce the risk. And so here you go. Ready? Don't smoke, watch your weight, eat a healthy diet, exercise, control your blood pressure, control your blood sugar, control your blood cholesterol, sleep well. And there you go. Okay? Thank you for the opportunity to chat with you today.